chest wall, okay? So you're inspecting to make sure that it's, you know, there's no, you know, abnormalities,
Lesions.
lumps, lesions, anything, any asymmetrical areas on the chest when they breathe in. And then the second one is you are going to observe for jugular venous distension. You do that at what? How should you have your patient lying when you do that? 30 to 45 degrees. Yes.
Okay. And I'm not going to tell you guys that, so you guys should know that.
Mm-hmm.
If you have them like this, and then, you know, I'm not going to cue you guys.
Right.
Could we just verbalize if the dummy can't sit up or something? I would position my patient at 30 to
Yeah,
45
but you're going to do it on your
degrees.
partner. So.
Oh, that's true.
Yeah,
That's
you're gonna
true.
do it on
Okay,
your partner.
forgot.
So anyway,
You call your partner dummy.
The dummy can't sit up.
so then we're going to palpate and auscultate the carotids for bruits. So the first thing you're going to do, you're going to look and you're going to palpate your carotids. You're going to palpate down here, not up here. Remember? Mm-hmm. Okay, so you're going to palpate here.
You can only do
but
one side.
Yeah, you only do one at a time. Okay. Do one at a time, and then you're going to listen for bruits using the bell of your stethoscope.
And if you don't have a bell, I have one that does not have a bell, so you would know to what? You would tell me what?
Using the bell of my stethoscope.
Yeah.
Okay. Oh, just go ahead. I'll
And
explain
then-
it later.
Okay. So once you palpate your carotids, which you do one at a time, then you auscultate for bruits using the bell of your stethoscope. Okay. And then let's see here. Okay. All right.
And then you would locate the apical impulse, the
Okay.
point of maximum impulse.
Okay, so you're going to feel with your hands. You can feel it. It's like a throbbing here. Okay, and then we do this here, and then you feel up in the upper chest area, but it's actually down here. Okay, at the fifth intercostal
Can you go
space.
directly to the apical?
Just go to the apical
If you feel,
pulse.
if
Just
you
go
feel, I mean, if you go there and you feel it, yes. But actually, this is what I do, so I
Yeah.
don't know if you.
No,
want me-
usually you should be able to feel it. Usually if the person's
Yeah.
like a little bit more obese, then you would have them lean forward,
Mhm.
okay, or lean to the side in the bed.
Depending on the body size, you may be able to feel it better in certain areas, depending on, you know, their body size.
Yeah. Okay, then auscultate the 5 cardiac
Okay.
areas.
All right. So then you would auscultate at the second intercostal space on the right side, which is the aortic area. So you feel for your second rib, and the second intercostal space will be right below that. So then you'll feel for your aortic area,
And you're verbalizing that.
and you're verbalizing that. And then you go over to directly across the sternum on the left side, the left intercostal space is the pulmonic area. Okay? And then the third space, okay, the third intercostal is the Erb's point. And then the fourth is the tricuspid area. And then the fifth space is the mitral valve area, the mitral area where you'll hear the apical impulse. Okay?
All right, the next one is check radial and brachial pulses.
Okay, so you take your arm in your hand, okay? You can feel for the radial pulse on the side where the thumb is. Your brachial pulse is on the inside of the arm, right
Not
in
the
this
outside.
area, not the outside, the inside. Okay, here and here.
You
Okay.
palpating at the same time?
No.
You can palpate
You
at
can
the same time.
Yeah.
Doesn't
but-
matter.
Yeah, it doesn't matter.
Yeah, so you palpate, okay, all right, and then you do the same thing to this arm, but then you check for capillary refill. So you're pressing down on the nail beds, and you let go to see how fast it takes for it to return color. And then also too, I don't know if this is to be included.
No.
Okay, so just capillary refill, nail beds, okay, and you do it on
Less
both
than 3
arms.
seconds is all you guys
Yeah.
have to say. Now, what I forgot to do was forgot to palpate, because I did the inspection, but what you're going to do is, what are you going to use to palpate the chest, the back part? Sorry, Ann, I don't want to. Okay, the pads of your fingers, okay? You can do it both at the same time, okay? You
Just-
can say, huh? Yeah, just down, straight down, and yeah. And what are some of the things you're going to say while you're doing it?
No mass, no lesions.
No crepitus noted, okay? That's it.
guys compact it, or will